Welcome to Lexcura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of Lexcura Summit. Falls in acute care are among the most frequently litigated events in hospital settings, but they are not analyzed in the same way as falls in nursing homes or long-term care facilities. The Morse Fall Scale, acute care nursing assessments, medication review, care planning obligations, observation requirements, and post-fall response all operate within a different clinical environment and under different benchmarks. In this episode, I will explain what distinguishes a hospital fall case from a nursing home fall case, how to identify the correct standard for each setting, and how to build the clinical argument around risk recognition, prevention, response, and resulting harm. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of Lexcura Clinical Insights. Did you know that falls are one of the leading causes of injury-related deaths for older adults? And yet, depending on where they happen, a hospital or a nursing home, they're treated completely differently. Today, we're unpacking why that is and what it means for patient care.
That's such an important topic. At first glance, a fall might seem like a simple accident, but when you start looking at the context, the differences between a hospital fall and a nursing home fall are pretty striking. So where do we start?
Let's start with the environments themselves. Hospitals are acute care settings. Patients are there for short-term treatment, maybe surgery, an illness, or some kind of medical emergency. The focus is on immediate recovery and getting them back home. Nursing homes, on the other hand, are long-term care facilities. Residents are often older, dealing with chronic conditions, and they're there for ongoing support, not just a quick recovery.
Right, and that distinction alone sets the stage for how falls are perceived. In hospitals, falls are often seen as preventable incidents. They're treated as system failures, and when they happen, they trigger investigations and reviews. In nursing homes, though, falls are more common and are often seen as an unfortunate but expected part of aging.
Exactly. And that difference in perception influences everything, from the protocols in place to the legal and emotional fallout when a fall does occur. For example, hospitals often have strict fall prevention measures. You'll see things like bed alarms, non-slip socks, and even hourly rounding by nurses to check on patients.
And yet, even with all those precautions, falls still happen in hospitals. When they do, it's a big deal. There's usually an immediate investigation to figure out what went wrong. Did the staff assess the patient's fall risk? Were the right precautions in place? Those are the kinds of questions that come up.
And the stakes are high. If a fall is deemed preventable, it can lead to lawsuits, regulatory fines, and even a loss of accreditation in extreme cases. Hospitals are under a lot of pressure to keep their fall rates as low as possible.
Now compare that to nursing homes, where the situation is a bit different. Residents in nursing homes are often at a higher risk of falling simply because of their age and health conditions. They might have mobility issues, cognitive decline, or even medications that increase their fall risk.
And because of that, the focus in nursing homes is often more on managing risk rather than eliminating it entirely. They might use things like grab bars, mobility aids, and padded flooring, but the reality is that falls are going to happen.
And that's where the clinical distinction comes into play. In a hospital, a fall is often seen as a deviation from the norm, a sign that something went wrong. In a nursing home, it's often seen as part of the natural progression of aging and frailty.
That's such an important point. And it's not just about how the falls are perceived, but also about how they're documented and investigated. In a hospital, there's usually a detailed incident report. They'll look at everything from the patient's medical condition to the staffing levels at the time of the fall. In a nursing home, the documentation might focus more on whether the resident was being appropriately supervised and whether the environment was as safe as it could be.
And that brings us to the legal implications. Because let's face it, whenever there's an injury, there's the potential for a lawsuit. But the way these cases are handled can vary widely depending on whether the fall happened in a hospital or a nursing home.
Absolutely. In a hospital setting, the focus is often on whether the staff followed established protocols. Did they assess the patient's fall risk? Did they take appropriate precautions? In a nursing home, the focus might be more on whether the facility provided a safe environment and adequate supervision.
And that's where things can get tricky. Because let's be honest, no system is perfect. Even with the best protocols and the most dedicated staff, falls can still happen.
They can, and that's why it's so important to look at the bigger picture. Was the fall an isolated incident, or was it part of a larger pattern of neglect or poor care? That's the question that often comes up in legal cases.
And it's not just about the legal implications either. There's also the emotional toll on families, staff, and even the patients or residents themselves. A fall can be a traumatic event, no matter where it happens.
Absolutely. And that's why it's so important to have open and honest conversations about these issues. Because at the end of the day, the goal is the same in both settings, to provide the best possible care and quality of life.
Well said. So what's the takeaway here? If you had to sum it up, what's the one thing you'd want people to remember about the distinction between hospital falls and nursing home falls?
I'd say it's all about context. A fall in a hospital is often seen as a failure of the system, while a fall in a nursing home is often seen as an unfortunate but expected part of aging. Understanding that distinction is crucial for anyone involved in healthcare, whether you're a provider, a caregiver, or even a family member.
Agreed. And I think it's also important to remember that while falls can't always be prevented, they can be managed in a way that minimizes harm and maximizes quality of life.
Absolutely. And that's something we should all strive for, no matter the setting. Thank you for listening to Lexcura Clinical Insights. A fall case cannot be evaluated correctly without first understanding the care setting. In an acute care hospital, the analysis should examine the Morse-Fall scale, nursing reassessments, medication effects, changes in condition, mobility status, observation level, alarms, toileting needs, handoffs, and the immediate post-fall assessment. In a nursing home, the focus may extend more heavily to chronic risk, long-term care planning, supervision patterns, environmental safeguards, staffing, prior falls, and whether interventions were sustained over time. The event may look similar, but the clinical duties, available resources, and documentation expectations are not the same. The strength of the liability analysis comes from applying the correct benchmark to the correct setting, and then connecting the failure to the circumstances of the fall, the injury, and the harm that followed. For more clinical intelligence, litigation analysis, and practical guidance, visit Lexcura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of Lexcura Clinical Insights.